Welcome to Deuk Spine Institute live stream spine surgery. It is Tuesday, July 21, 2026. Our patient presents to us with debilitating lower back pain. And as I stated before, Jordan, come on over here. She had surgery by us done, and now she's having another surgery done. Her prior surgery was her piriformis SI. We're doing 3-4-4-5, correct? Any chance of a discogram? It'd be nice in retrospect. Which side am I on, Luis? Wherever you want me to start. I'm going to be talking to you throughout the surgery. This patient is having laser spine surgery. Laser spine surgery has different ways of being done at Deuk Spine Institute. We've been doing it the same way for 20 years. Why? Because our success rate is 99.6% cure of disc back pain that emanates from an injured disc. She has several injured discs in her back, L2, 3, 3, 4, 4, 5. But her pain is not up at L2, 3. It's down at 3, 4, 4, 5, which is why we're only operating at 3, 4, and 4, 5. If you look at her MRI, you can see there's a 2, 3 herniation as well. But we're not doing 2, 3 because we don't operate on discs that are damaged when they don't cause symptoms. So to operate on a disc, it must be damaged. It must cause symptoms. That's the only reason to do surgery on a disc. Until now, until the Deuk laser disc repair, doctors only had fusions, artificial discs, to really treat back pain. Of course, we had other treatments like pills, shots, which were all temporary. But until now, we did not have a minimally invasive treatment that specifically targeted the source of back pain. And there are 30 sources of back pain. Shot? Anthony, why don't we share with our audience the 30 different causes of lower back pain? I'm Dr. Deukmedjian with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. All right, our patient's had back pain for 10 years. She originally came to me, she said it hurts here in my spine, but I also have pain down here in my SI and piriformis. So she wanted that treated first. We did great, pain's gone there. Now she's coming back to get laser spine surgery to repair 2 herniated discs, L3-4, L4-5. And we've just placed the needles into the discs. She's done fantastic. We gave her a little sleeping medicine, and now we're going to do what's called a discogram. A discogram is a test where I will inject 1 cc, 1 milliliter or 2 milliliters of liquid into the disc. It's basically saline, which is what your body has in it, with a little bit of blue dye and some Omnipig. And the test is an evocative test. So if the disc is painful, the patient will say, "Oh, it hurts." And I'll ask her, "Is that where you typically get your back pain?" If the answer is yes, we call that a concordant response. Concordant, C-O-N-C-O-R-D-A-N-T. Concordant back pain means I found the source of her back pain. She'll be able to tell me, yes, that's where I get my pain, right there. Now, of course, we're also going to write down how bad the pain gets on a scale of 1 to 10. How much time do you think you need? Any questions from our audience?
Yes, we have one question from Ishad on YouTube.
Sure.
I had a laminectomy last year, but I have developed pain in both legs and buttocks with posterior tilt. Can't sit, walk, or lie down properly. Doctors advise me having a TLIP fusion. What do you advise?
I advise you, very simple, meet with me. It's free. I do it over Zoom. You can do it from your house, your business, wherever you are. I will meet with you, look at your MRI. I will tell you exactly what needs to be done. But I can guarantee you don't need a TLIP or TLIF, okay? That's a fusion. And doctors are still recommending fusions because they don't know how to do these less invasive surgeries. But please, before you commit yourself to such a dangerous surgery with fusion, with screws and rods and cages, give me a chance to diagnose you and show you what we can do here at Deuk Spine to help you. All right, are we ready, Dr. Berndes? All right, are you having any pain?
Are you having any back pain?
No?
No.
All right, are you comfortable? Don't talk too much, just say yes or no. We're going to put you back to sleep in just a minute, okay? Are you having any back pain? I couldn't hear. What did she say? Do you having any back pain? No. How bad is that? You guys see that? She came off the table. How bad is that on a scale of 1 to 10?
What's the number? 8.
No, the highest it went. What was the highest?
What's the highest?
9. Is that where you get back pain? Is that where you typically get back pain? Yeah. All right, don't nod. You got to answer. Wow. You guys saw that. She went, and she almost came off the table. So L45, definitely causing back pain. Jordan, show us, and Anthony, go to the x-ray. Folks, take a look at the dye. It should be like a cotton ball right in the middle, but it's not. It's leaking out through tears in the front and back of the disc. It's only the ones in the back of the disc that actually hurt. The ones in the front don't hurt. We're not fixing the one in the front. Are you better? Are you better? All right, I'm sorry about that. How bad? I'm so sorry. How bad is that on a scale of 1 to 10? You can hear her probably, right, Anthony? Relax.
Yeah, sounds like
You're fine. Everything's okay. We just had to test the disc.
She said it was a 10.
All right. Is that where you get pain? Just relax. Take some deep breaths. We're going to put you to sleep. When you wake up, that pain will be gone. G-O-N-E. All right. So, thank you, Dr. Berndes. You're doing fine. Hey, take your time. I know her airway issues. Go slow. I don't mind waiting. I'm going to talk to the audience. So, folks, you just witnessed an evocative discogram. Now, had I injected that small bit of dye into Luis's disc, my assistant here, he wouldn't even know it's injected. He wouldn't feel anything. Because injecting into a normal disc that's not painful, or even a herniated disc that's not painful, will make zero pain. Zero pain. And we've seen it before where the patient has no pain from a herniated disc or a degenerated disc. Why is that? Because 9 out of 10 patients with herniated disc have no symptoms. That's because their body has healed. The herniation's never gone away, but they've created a wall of scar tissue around the herniation so that it doesn't cause inflammation. We're going to get started whenever Dr. Berndes tells me we got the green light. Any questions?
no questions.
So just for those of you wondering why are we torturing our patients, we're not. We're just verifying that we're doing the right treatment for them right here on the operating table before we actually do it. This is a dilator. Can you see this, Anthony?
Yes, we can.
It's tapered at the end so it doesn't cut anything. It doesn't have a cutting end. It has a spreading end because everything under your skin is spreadable. What does spreadable mean? It means just like this thing right here, okay? Give me something that can go through it. All right? Let me see that. Let me see this. You guys see this cotton right here?
Yes,
Okay.
we do.
It's fiber. It's got fibers, right? If you take the needle and pass it through, you're not cutting the fibers, you're spreading them apart. Okay, that's what we're doing. We're spreading the muscle, the fascia, everything is being spread. We're not cutting or damaging anything inside. That's why patients with this surgery at Deuk Spine Institute, the Deuk laser disc repair, they don't need narcotic painkillers afterwards. If you go get a laminectomy or TLIF or ALIF or XLIF or OLIF, any type of invasive surgery, patients are going to be in horrible pain afterwards because the surgeon is cutting open their body. A little bit, maybe just keep an eye on her. I'm right on the disc right now, the painful disc. This is, should I feel her responding a little bit? All right, we're just about done. There we go. I think we're in. That was a big tear, by the way. You see how easy that dilator went in? It took almost no effort. Just gentle little taps with the mallet, and I was able to advance the tip of the dilator through the annular tear in the back of the disc on the right side at L45. This is where her pain is coming from. You can clearly see her responding, not just vocalizing before, but also physiologically, you can see her blood pressure go up, her heart rate go up. Now we've got her under anesthesia right now, so she's comfortable, but we got to still be very careful. Any other questions?
No questions.
Let's show the audience how a herniated disc in the lower back can cause so much pain for a patient.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-692.
Back. Can you see down the endoscope here?
Yes,
Can
we
you see
can.
this? All right, what you're looking at is a torn annulus called an annular tear. It's easy to see on an MRI scan, and the blue stuff is herniation stuck inside the annular tear. It's actually the blue stuff that causes inflammation as a response by the body. The inflammation is what produces the pain. Any questions?
No questions.
So have we shown the audience the 30 causes of back pain?
Yes, we have.
Have we shown the audience how a herniated disc in the lower back causes lower back pain?
Yes, we have.
Have we shown them how we fix a painful herniated disc in the lower back?
No, we haven't.
I think that's a great idea, Anthony. What do you think?
Yeah, sounds great.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
I've been asked a serious question. Why would I vote for Spain in the World Cup? The answer is Argentina's won a lot of World Cups, but honestly, I just think Spain was a better team this year. And I think they really deserve to win. I just think they had the better players, they were more organized, they played better, they were really in great condition. That's just my take. I was expecting Spain to win. I would have been equally happy if Argentina won. I love both teams. I'm impressed with both teams. And I thought that it was really nice to have the FIFA World Cup soccer in the United States, Mexico, Canada this year. North America, South America. I thought it was amazing. Very special. And we had so many people that came and saw the United States, Mexico, South America, Canada, a lot of fans from over in Europe and other parts of the world. I just thought it was an incredible event, you know, bringing the world together. And it gave a lot of foreigners an opportunity to see what life was like in the United States. Because let's face it, today in the year 2026, there's a lot of misinformation out there on the internet about things. And I think a lot of people don't really know how great the American people are. America is a great country, and the American people are great people. So I thought it was very nice. I felt very proud of my country that we were able to showcase our beautiful cities, also our neighbors in Mexico and down in South America. You know, all the games that were played in Mexico and Canada, and all the South American teams that were so good this year. I was a little disappointed in the United States falling out, but you know what? It was kind of expected. I don't think we've ever been that strong in soccer. Unfortunately, we don't prioritize soccer in America. Never have. I think someday we will. I think now that we had the World Cup here in our country, maybe it'll inspire more of our youth to play soccer instead of football or baseball or other sports, basketball. The other thing I was impressed with is how many really tall players there were on these teams. I mean, when I played soccer, I played for the United States back in the 80s, and I was on our national team playing in Europe. And soccer players were, 6 feet tall at most. Sometimes you'd see somebody who was 6'2", but it was rare. Now it seems like almost every player on these teams is 6'4", right? They're tall and very fast, very fast. They're incredible athletes. So it was honestly, when somebody told me the World Cups in the United States and Mexico and Canada, I said, I probably won't watch it, but I ended up watching a lot. And I was glad that I did. It was nice to see what's happening in the world with soccer today. All right, any other questions, comments?
No questions.
So we've shown the audience how disc injuries are so painful. They're the #1 cause of back pain, disc injuries, such as a herniated disc. Right there at 12 o'clock, folks. You see that at 12 o'clock, that red stuff? That is the inflammation I've been talking about. And look how the laser can remove it. All right, let's show the audience then, if there's no questions, how the Deuk laser disc repair procedure is better than laminectomy, microdiscectomy, discectomy, artificial disc, spinal fusions, A-lift, T-lift, X-lift, O-lift, P-lift. Why is this surgery you're watching the best? The best of the rest. Hi, I'm Dr. Deukmedjian. We've just completed our free MRI review with Deuk Spine Institute, and I've diagnosed you with discogenic back pain. The spine is made up of many bones and joints. It's the joints that are actually the source of back pain. The disc is by far the most common source of back pain, as is in your case. It is the cause of your back pain, the primary cause. In your case, the primary cause of your back pain is an injury to a disc in your lower back that is causing inflammation and hence back pain from the inflammation. Inflammation is the source of all pain in the body, whether it's a broken bone, whether it's an injured joint or an arthritic knee. Pain comes from inflammation. Inflammation is a process where your body is trying to repair a damaged joint, and it creates swelling, tenderness, heat, and pain. The pain you're experiencing in your lower back is primarily coming from a small tear located within the back of the wall of a disc. Now, I may have diagnosed you with more than one disc as the source of your pain, and each of those discs cause pain through the same mechanism. As you see in our video, trauma causes a tear in the back wall of the disc called a posterior annular tear. At the same time, it fragments the nuclear material just inside the wall, and over time, after the injury, you, through activities, push out small fragments of disc herniation into the tear, which then causes cycles of inflammation and pain. And that's why you're experiencing your lower back pain. At some point, your back pain could become permanent and not just reside in your back and not ever leave. But typically people go through a phase where the back pain is cyclical, where it comes and goes, and activities are generally the cause of the back pain flare-ups. In your case, we can fix your back pain by performing a state-of-the-art procedure only available here at Deuk Spine Institute. This is a minimally invasive arthroscopic procedure performed with a laser. This procedure is called the Deuk laser disc repair. We've been performing the Deuk laser disc repair since 2006 here at the Deuk Spine Institute. To date, we've had 0 complications. The Deuk laser disc repair is the safest, most effective treatment for back pain coming from an injured disc like yours. We're recommending you consider the Deuk laser disc repair as your primary and main treatment option to get rid of your back pain quickly and permanently with minimal impact on your life. Recovery from Deuk laser disc repair is just 1 hour. You're going to go back to your hotel after the surgery. You'll spend the night in your hotel recovering, and then in the morning you'll come in for a quick checkup. The checkup usually takes about 30 minutes, and then you can go back home after the checkup. Alternative treatments to the Deuk laser disc repair are far more invasive, and the outcome of those treatments is far more uncertain. There are many surgeons offering treatments such as laminectomy, discectomy, spinal fusion, disc replacement. Other treatments include injecting materials into your spine, such as epidural steroid injection, or injecting material into the disc itself that will supposedly repair the disc. I can tell you, we used to perform these treatments and they don't work. They either don't work or they don't last. And if they do work, they work temporarily, and they're associated with a high complication rate. For example, laminectomy is highly invasive. There's destruction of muscle and bone and ligament in your spine. When the surgeon removes the bones and ligaments out of your spine, it creates tremendous amount of scar tissue and instability of the spine. Patients frequently come back needing spinal fusion. Patients with laminectomy are often in chronic back pain for the rest of their life, going in and out of pain management, on and off of pain pills, and in and out of physical therapy. They frequently require multiple surgeries in order to feel some type of pain relief. An alternative treatment is called a microdiscectomy. Microdiscectomy is another invasive procedure where the surgeon is removing bones and ligaments to get down to a herniated disc that's pinching a nerve root. Microdiscectomy is not a treatment for back pain. It is only recommended for leg weakness, leg numbness, and leg pain. Microdiscectomy does not fix back pain and should be avoided if you have back pain. Laminectomy does not fix back pain and should be avoided if you have back pain. Spinal fusion is a treatment for back pain. The surgeon must either remove or fuse the disc using hardware such as screws, rods, and bone graft, including cadaver bone graft. You're receiving biological bone graft from a dead person. That's what's allowing your bones to fuse together. Now, these spinal fusions can be quite effective at eliminating discogenic back pain, which is the type of back pain that you have. However, they carry a very high risk of complications. Complications such as blood clots in your legs, which could migrate to your lung and kill you in a process called pulmonary embolism. They also have a high risk of infection. Every patient that does a fusion requires postoperative narcotic opioid pain medication. Opioids are known to be dangerous, addictive, and have a high potential for abuse. You don't want to start opioid painkillers if you can avoid it. With the Deuk laser disc repair procedure that we have recommended for you, there is no need for postoperative opioids. Our patients are treated with a small 7mm incision. That incision has minimal to no bleeding, and it heals within a few days. There is no need for narcotic painkillers. If you have the Deuk laser disc repair, we can fix the back pain within 3 days coming from your damaged disc. We recommend you talk to our schedulers. They'll answer any additional questions you have. We'd love to see you here at Deuk Spine Institute and provide you with the highest quality, most advanced treatment in the world that gives you the safest, most effective outcome in the world that lasts a lifetime. Thank you for listening. Welcome back. Watch it. We are finished repairing L4-5 disc herniation. Now we're moving on to the L3-4. Because she has pain in both legs, we decided to do the surgery from both sides so we can fix the pain in both legs. The L3-4 was worse on the left side, and the L4-5 was worse on the right side. Hence, the decision to treat the discs on separate sides, which is pretty common, by the way. We always go on the side where there's leg symptoms. If both sides have leg symptoms, well then we go on both sides. So now we're going to go down to L3-4. We've just finished L4-5. Remember, L3-4 was the 10 out of 10. So she may respond to this dilator touching the herniation, because that's where the worst pain was. You take your time, Dr. Berndes. While he's giving the patient a little more anesthesia, any questions?
No questions.
All right. It looks good. You can see the tip of the dilator. Jordan, show the audience. Anthony, go to the x-ray. You see the tip of the dilator pressing against the herniation in the foramen.
Yes, we can.
Here we go. You ready, Dr. B? Dr. Berndes is adding a little pain medicine to the patient's circulatory system and eventually their presynaptic terminals. Narcotics, opioids, work by binding presynaptically to neurons involved in pain transmission. And they block transmission of neural impulses along pain pathways presynaptically by reducing the amount of calcium that influxes in the presynaptic terminal, thereby reducing the amount of neurotransmitter released by blocking synaptic vesicle exocytosis, which is, I believe, clathrin-mediated exocytosis from the axon terminal. For those of you who are neurophysiology junkies, we're going to be done in 8 minutes. I need the scope view. You can see through the endoscope, we are inside the herniation at L3-4. There's a big piece of herniation right there. I just pulled out part of it. And I'm going to use my grabbers to remove pieces of herniation. There's a piece. Hold it. That's a good sized chunk. What a wonderful surgery. No post-operative narcotics needed. And patients are back to walking around and having a relatively normal life within hours of your surgery. 20 years of performing this surgery. This is number 2,788.
Yes.
We're almost at 3,000. We are going to have a 3,000 party, folks. 3,000 laser spine surgeries here at Deuk Spine Institute. Imminent. Imminent, imminent, imminent. Probably in 2026 or early 2027. All right, any questions from the audience about how this surgery works, why it works to eliminate and get rid of and cure back pain that comes from a disc herniation?
No questions.
Great. You guys know everything. I love it. Right, Kimmy? We have a smart viewership. We are now using the laser here. It's a 1 millimeter laser fiber. If you were here for the last surgery, you saw that we had a 0.5 millimeter fiber, 0.5, half a millimeter. This is a 1 millimeter fiber. So for the lower back, we use 1 millimeter. For the neck, we use half a millimeter. It's a skinnier, smaller fiber. Both fibers are glass fiber optic fibers. They transmit laser energy made in a machine sitting at the patient's feet. These machines sell today for $200,000 per machine. They are very expensive. These are the best lasers manufactured in the world, made in Israel. This is a FDA approved holmium YAG laser. There's a lot of honest to God nonsense out there, for lack of a better term. Surgeons trying to discourage patients from having laser surgery because, well, they don't know how to do the surgery, but also they don't want to lose the business. They're trying to keep the patients from leaving their office and going and having better surgery elsewhere with a laser. Now, most of you don't know this, but before I was doing laser surgery, I was a fusion and artificial disc surgeon. And that's all I did. Laminectomy, discectomy, microdiscectomy, spinal cord stimulator, spinal fusion, artificial disc. And I did a lot of them, thousands. And my patients did exceptionally well. Even to this day, if you go and look on our website, you will see our dancing spinal fusion patients. They're dancing 2 hours after their fusion in our recovery room, heading home, being discharged, not staying in the hospital, not in pain, but laughing, giggling, and dancing. Those are my fusion patients. That was 15 years ago. To this day, spine surgeons cannot reproduce my results with spinal fusions. And we've moved beyond spinal fusions. We're leading the world in spinal fusions in terms of outcomes. And I've even published my results for lumbar fusion. If you go to PubMed, you look up Dr. Ara Deukmedjian, you will see many publications, and you will see publications in PubMed, our National Library of Medicine, of spinal fusions. You'll see that I had phenomenal results, especially with these T-lift surgery, transforaminal lumbar interbody fusion. Great surgery if you don't have laser. We're done in 2 minutes. But now that we have endoscopic laser, there is no reason to do these fusions anymore. I've converted from doing 150 spinal fusions a year to performing virtually none. Why? Because this surgery you're watching right now has far better results and patients love it. They don't have to go to the hospital. They don't take post-operative pain medication that gives you constipation, puts you at risk of respiratory failure, an addiction, and tolerance. This surgery requires no pain meds afterwards. Patients don't take post-operative pain meds from this surgery because it's so minimally invasive. All right, we're done. I'm just going to grab a few more pieces of herniation, and I'll take any last-minute questions you guys might have.
Okay. We have a question from John on YouTube.
Hi, John on YouTube.
I'm a longshoreman. If I had this surgery, how long would I be out of work?
That's a great question, John. Well, here's the thing. If you have this surgery, your pain will be gone the next day. However, if you lift heavy things too soon, you'll re-herniate. Our re-herniation rate is 1%. So what does that mean? It means you cannot bend over and pick anything up off the deck of a ship or a dock. Okay, you have to use lifts, but you yourself have to keep your lifting under 50 pounds the first year. 50 pounds. So as long as you can keep your lifting under 50 pounds and you don't have to bend over, pick up packages and stuff from the ground, then you can go back to work within a week. Think about your future. That's what's important. You don't want to have a fusion because that's going to create more problems. You're going to never stop having surgery the rest of your life. This surgery is a definitive treatment. You come, you get it done, and you're finished. You can get on with life. You can heal up. After 1 year, you can go back to doing anything you want. You can go bungee cord jumping, skydiving. You could squat 600 pounds, no problem. But you got to let those discs heal for 1 year. All right, thanks everyone for joining me. Our next patient has the same procedure happening in the lower back for 2 painful discs, and he travels here all the way from Missouri. He's from Missouri. He's here for his lower back, and then on Thursday we're going to fix his neck. Thanks for joining us. I'm Dr. Deukmedjian, CEO and founder of the Deuk Spine Institute. I have a patient with me who just had the Deuk laser disc repair less than 24 hours ago, about 12 hours ago. And here you are. How do you feel today?
I feel better than I have in probably half a year, I'd say close to 5 or 6 months. It's one day after and time will tell, but I didn't think this was possible this quickly.
Yeah, time will tell. We've done now 2,200 of these surgeries with the laser endoscopic. Consistently, the pain is gone. It's permanently gone. It never comes back. And so I'm excited for you that you're gonna do fantastic. Now, you live about an hour away. How did you find out about Deuk Spine Institute?
I got a referral and noticed that it was only an hour away, so made my way up here, and the first time I came for a visit was kind of felt like home, kind of felt like where I should be anyway, so that kind of fit right into everything this far. So
You had, was it back and leg pain, correct?
back pain a little bit, but my biggest issue was shooting down the leg pain. It was numb all the time for about 4 or 5 months on and off, so didn't know what else to do, and this was the right choice, I would say.
You came to us and we found weakness also. You had weak pulling your toe up. That's because the nerve was pinched so bad at L5S1. You can see here on the video, we went in with a tiny Band-Aid incision, 1/4 inch. We went in and basically removed most of the herniation, cleaned up the tear where it came out of so that the tear will now heal. Your disc will heal naturally. And we did it all without removing bones or ligaments. If you had had a microdiscectomy or laminectomy, which is what every other surgeon offers, because they don't know how to do the endoscopic surgery, it's a newer technology, then you would have had a bigger incision, you'd be in a lot more pain today, and you'd have bone and ligaments taken out of your back. It would weaken your spine, which would set you up for fusion. But with our surgery, there is no need for any future treatment on the disc. It's permanently fixed. Now, are you taking any pain meds today?
I haven't yet today, and I haven't felt the need to, which was another surprise I had too.
Yeah,
So
no pain meds, right?
Nothing.
No bleeding, no hospital, no pain meds.
Nope, in and out pretty quick. It worked out pretty well.
Pretty happy?
I am.
And you were referred through Coral, right?
Correct,
Coral
correct.
Network.
Coral Network,
What
yep.
do you have to say to the Coral people who approved your surgery?
I just appreciate the approval and the opportunity to live like normal and be a normal human again.
Yeah, Coral did you well. I guess they somehow got you to us and you avoided having an invasive surgery that was going to hurt you more than help you.
Correct.
Congratulations.
Yeah, well, thank you, Doc.
Anything else you want to say to your fans out there in YouTube land?
I would just encourage you to look into Deuk Spinal and figure it out if that's the right fit for you, and it was for me, absolutely. So, thank you.
You're welcome, my friend.
Appreciate it.
Congratulations.
Take
Take care.
You too.